My name is Robert Parnes. I'm a pediatrician, and I went to medical school at New York University, and I have been in private practice here in Vernon since 1988. My practice originally was in the Vernon Professional Building on Hartford Turnpike, and since 2001 I've been in a building that used to be the Vernon Cinema, the old Vernon Cinema. For those of you who don't remember the Vernon Cinema, it was a 99-cent movie theater, and then it was $1.99, and then I think the DVD era and such knocked it out of business. So the building was empty for a while, and then we renovated it, and since 2001 my practice has been here. People will often ask me why I chose to be a pediatrician. Parents will ask me that question, and sometimes even the children will ask me that question. And when I'm asked that question, I think back to when I made that decision, which was back when I was in medical school. There were a couple of factors that were involved. I was looking at different fields to go into, which would be the right one for me. And one of them, quite honestly, is to interact with the children. I could play with the children. I can play with the children. I mean, realistically, what jobs do people have out there where they can spend time fooling around, having a good time with children? And that's part of the job. Most jobs, you have to be serious all the time. This job, you can have fun. And there was one other factor that really should be worth mentioning, is that children are healthy. They're inherently healthy. And what that means is when they are sick and have even a serious illness, most likely they're going to recover. And that's very, very rewarding and reassuring to us that we have such patients to take care of. So people will often ask me, how do I establish a relationship between myself and the patient? And realistically, the relationship is between myself, the patient, and also the family. What I like to do is I like to read the records of the patient. If someone is transferring into my practice, I like to read the records from the previous physicians before I see the patient. Then when I meet them, I'll often ask the parents and the child questions that might not seem to be totally relevant to what's going on in that visit. I'll ask the parents what kind of work they do, what about their background, their ethnicity. I'll ask the child what they like to do. This helps me to get a relationship with the patient early on as best as possible. One thing I won't do is ever tell a patient that something doesn't hurt when in fact it does. If you say to a patient that this shot really doesn't hurt when it really does, then they won't believe you. You won't have trust build their trust. And then when there's a time when we need to have their trust, when they need to trust me to open up to me, then they might not do it. I've been in practice in Vernon since 1988 and have worked with ECHN and its predecessors since that time. First I was on staff at Rockville Hospital, and then Manchester Hospital, and then ECHN. And that has benefited my practice greatly. The one big advantage of that is that we have emergency rooms and X-ray facilities and laboratory facilities right here, just down the road, a very short distance away. So what that allows us to do is if we need to use these services, our patients can use them quickly and easily. They don't have to drive into Hartford, they don't have to wait long hours, et cetera, et cetera. In addition to that, my practice has been on electronic medical records since 2007. We're part of HealthWise Medical Associates. ECHN has been on electronic records in their laboratories and their emergency rooms, and what this allows us to happen is for a seamless transfer of records, so that when I order a laboratory test at ECHN, those records are automatically transferred from ECHN's computers into our computers. When our patient is seen in the emergency room, those records are automatically transferred from their chart to our chart, so that the information is shared quickly, easily, and efficiently. This is much better than what happens when patients are seen at other hospitals or have labs in certain other laboratories. So in closing, I'd like to say that I've been in practice, as I've said, since 1988, and quite honestly, this has been very rewarding to me. This is the type of community that I like to practice in, and I really look forward to continuing working here in Vernon for the next, who knows how many years. I'm not planning on retiring anytime soon.